Well, good afternoon, everyone. Jim Padbury here, representing the team at Advance-CTR. This is our translational research seminar, and we have, as you can see, we have a special presentation today by Jacquelyn, Fede, and Julie Plaut. They're going to present on ascertaining, understanding, and addressing health priorities in Rhode Island. Jacquelyn is a research associate with Advance-CTR and an assistant research professor in the Department of Psychology at the University of Rhode Island. Julie Plaut is the director of Engaged Scholarship in the Swearer Center at Brown University and assistant dean of the college at Brown University. I just want to cover a few of the administrivata, so location of the bathrooms, how to do questions and things like that. The presenters will present concurrently. We welcome you to use the chat or for questions and answers. We're going to hold the Q&A until the very end, at which time we'll assist in helping you ask your questions. As always, we entreat you after this seminar is over to fill out the evaluation form. We are evaluated rigorously by NIH, so it's helpful for us to be able to turn that in. And then we also want to invite you to the April Translational Research Seminar, where pilot awardees Brian Kavanaugh and Luca Bartolini and other pilot project awardees Deepan Dalal and Ting Ting Zhang will be presenting their work. So without further ado, I'm going to turn it over to our speakers.
Well, thank you so much, Dr. Padbury and my Advance-CTR crew for having us here today. I'm really excited this afternoon to talk to you all about ascertaining, understanding, and addressing health priorities in Rhode Island. I want to give a shout out to my tracking and evaluation core team members, Dr. Judy Kimberly, Dr. Anthony Hayward, Dr. Stephen Kogut, and Dr. John Stevenson, all who have contributed greatly to much of the work that you will see today. I also want to extend a very big thank you to Dr. Julie Plaut and the Swearer Center. Dr. Plaut for presenting with us here today, but we have had an ongoing collaborative partnership with the Swearer Center for 2.5-3 years now, something like that. I could be wrong, someone can correct me. And it has been a great experience and very beneficial for us. So I'm very thrilled to be able to present with Dr. Plaut today. So just to give some background and aims about what we're trying to get across today, community engagement, community health outcomes, community health priorities, community health needs, these are phrases and ideas and things that you would be hard pressed to find grant applications and funding mechanisms that don't bring these kinds of terms and ideas and requirements into the mix. And I think more and more, especially in the past 5 to 10 years, and certainly over the past year that we have just experienced, I think you'd also be hard pressed to find researchers who would deny that this is an important thing and that this is something that is a good thing and a good direction to go in. And despite that agreement, despite that it's well documented and a believed notion that this idea of community engagement and trying to influence community health priorities is a good idea, it's really complex. Just figuring out what the health outcomes are, whose priorities, how to prioritize them when you have this wide range of stakeholders with all of these varying perspectives is really challenging. And beyond that, even if you had the perfect, most excellent list of priorities in perfect order, goodness of fit with your community is 100, integrating those priorities of that list into research is also very complex. So today, what we want to do is describe a process that Advance-CTR and the Swearer Center went through and is still going through to take inventory of what are the community health priorities in Rhode Island. We also want to show you some of the work that we've been doing to compare those health priorities to current and planned research in the state of Rhode Island. And we also want to provide you with more strategies and ideas and resources to help facilitate further addressing those community needs. So before we get going, I have a little mantra. We have a mantra for you to kind of think about as we go through this presentation. Why do you do what you do? Why do you do what you do as a researcher? How does your research connect to community health priorities? Does the community know how? And could you explain it to them? I want you to keep these things central in your mind as we go through this. And I have this tweet here from my own community, and it is an autistic self-advocate who's putting out this tweet that says, why did the actually autistic person cross the road? And the answer is a researcher saying, give me a generous grant, a reason why crossing the road is a challenging behavior plus 1,000 mice, and I'll answer that. And I love this tweet because it demonstrates something very important. One, that sometimes there really is such a big disconnect between what research is doing and what the needs of the community are. And this could be the case here, but it also shows that the community just could not understand what is going on in research, because while there are researchers doing things with mice that have no relationship with the actual needs of the community, there are also researchers doing wonderful things around biomarkers and early identification, and with an aim to get information and the best information we can get to parents and carers and communities so that the best environment can be built around this child who will have a different neurology. So keep these things in mind. Think about, why do you do what you do? And could you make that explanation to the community clear? Or do they have a clear understanding of what the link might be? Okay, that's your mantra. Now I'm going to talk a little bit more about the process that we went through to kind of fulfill that first step of taking an inventory of what are the health priorities in Rhode Island. What are the priorities that come up all the time from multiple stakeholders at various levels? For that, in that process, when we were gathering these health priorities from all these stakeholders at multiple levels, you will see priorities and strategies from the Department of Health, from our health equity zones, from organizations like the Rhode Island Foundation, also from the Hospital Association of Rhode Island, and their carrying out of their ACA mandated needs assessment. And you will also see priorities that we took from our own group concept mapping activity in partnership with the Swearer Center. And I will show you some of that as we go along. So and I will show you examples of how these priorities are displayed, but I'll tell you up front that in the great state of Rhode Island, we came across 112 health priorities that were put into a spreadsheet, and there were a wide range of total priorities per stakeholder. So the Hospital Association of Rhode Island, that you'll see, kind of just categorized their needs assessment results into 4 main priorities, whereas our own group concept mapping activity came up with 71 health priorities. And so there was a wide range of priorities, but also there was a lot of overlap between different stakeholders. And then there were things that were very specific to each group. So our next step was to try to understand, what were those themes among the priorities? What are the things that we keep seeing coming up over and over again, regardless of who the stakeholder is? And what are the things that are really specific to some of these stakeholders that we looked at that might not be accounted for in all of these other priorities from all of these other groups? So we sought to understand those priorities, and we wanted to understand those major themes because we really wanted to assess a baseline for clinical translational research in Rhode Island, and what we were funding. What is the alignment like between what we have funded so far and what Rhode Island communities say are their health priorities? And then I'll talk a little bit about how we've used some of these results and how we're continuing really to learn about that connection between what the priorities are and how Rhode Island has been addressing them so far, and what are the areas that we might, in which we might be able to improve. So I told you there were 112 priorities that we came up with. There are probably more that we could have gathered in our hunt, and probably more that we will gather as we go. But just so you can see some of the range of what these priorities look like and how they're presented, many of you have likely seen this. Here's our Rhode Island Department of Health priorities that has 3 leading priorities, 5 strategies, and I think you can go even further. And if you look into each of those 5 strategies, there's about 28 specific aims that go in there as well. So that's one iteration. It's also worth noting that the health equity zones largely follows and contributes to the development of these strategies. Then we looked at the Rhode Island Foundation, and this is just another way that people could display and put out their health priorities. So here they also have 3 major goals and then 5 priorities that they're looking at. They track a lot of their priorities using like a GIS system and GIS related indicators. So just another way to put out health priorities in Rhode Island, and more another source that we use to gather health priorities across the state. I told you the Hospital Association of Rhode Island, when they present their latest needs assessment, or the last time they presented one in person, I should say, here were the 4 major themes, and really it's 3 major themes all wrapped up in this one big theme of the social determinants of health. And that's just a few examples of the ways that entities and agencies in our state have displayed or have gathered and displayed what their priorities for health in Rhode Island are. I also told you that we carried out our own group concept mapping activity with the Swearer Center and along with their community partner network. It was a great activity. And here, if you followed along with the method seminar, the qualitative research method seminar, you have a good idea about concept mapping and how to do it. I will be quick with this, otherwise I'll go off, I'll take the whole time. But in general, the process is to issue a focus prompt that people answer qualitatively. It's an open-ended prompt, and they can answer with as many ideas as they have in response to it. And then those responses are kind of managed, and we make sure that we're only presenting unique ideas and that we're not having multiple ideas in one sentence. So what we're trying to do is get all those responses into nice single line item ideas from the prompt that do not repeat themselves throughout the list of responses. And then you present those responses back to your community and your stakeholders, and you have them rate these responses. And we had them rate those responses in terms of how important they thought each one was and how feasible they thought it was to do. So our focus prompt for this project with the Swearer Center was, what are your health-related goals for your community? And the Swearer Center Community Partner Network responded to this prompt, and they came up with over 71 brainstormed responses, and we pared that down to 71 unique ideas for health-related goals for the community. And you can see some of the examples here, like access to culturally competent mental and behavioral health care, decreasing risk factors for diabetes, lead-safe housing. There was a wide range. And here is just another slide to show you sorting and rating. They rated each of those 71 ideas on how important they were and how feasible they thought they were to carry out. And they were wonderful, very engaged, and they wanted me to give them the results of the analysis right there in the moment. But we did I couldn't do that, but we did go back and present the findings to them, and they had great insights on some of the action steps that we could take. So those were our overall themes right here from that concept mapping activity with the Swearer Center. You can see accessible and healthy housing, community youth, mental health, access to health services, recreation, and it's many of the same themes that you would see in the Department of Health from the Rhode Island Foundation, etc. So what of those 112 health priorities that came from all these different sources, including our concept mapping activity with the Swearer Center? What did we do? We really aimed to try to understand what were some of the major themes. And so of course I had to make a word cloud because that's just fun and a great visual, but immediately you can see things sticking out like those social determinants of health, like healthcare access, community, housing, food, support and care services. Mental health was a big one as well. So this is a great initial illustration just to give us an idea of some of the domains that we might be thinking about in the state of Rhode Island. And one of the first things that we did too, in terms of that baseline of, okay, we have some idea of the themes, we haven't really officially named them yet, but what does it look like in comparison to what we have funded as Advance-CTR and what we have been doing? And here, this list of domains or categories that you will see in the graph that comes up, these were derived from our PI, Dr. Padbury, in coding categories of the research that has been funded. So these categories were created before we had collected any of these health priorities. But we just thought, let's line these up and see what it looks like. And so you can see the dark green bars are the percent of the health priorities that fell into these categories. And the light green bars are the percent of our funded research that fall into these categories. And though this is a rough comparison, because like I said, these themes were made specifically for the research that has been funded, you can see immediately that there are some areas like mental health where things have gone well. And there are other areas that have lots of room for improvement, like that social determinants and health disparities category. And that's to be expected in our next phase of funding. When we get renewal, we will have a community engagement and outreach core, and it is not something that we have now. So it's the timing is right to have that core in place. It's a great visual to illustrate that. But like I said, those themes were created for a different purpose. They weren't created to look at the health priorities that we have gathered since then. And so here, this lovely purple gradient slide shows the priorities or the themes that came out of all of those 112 health priorities. Feel free to screenshot this because notice up top, utilization is informing researchers like you. Just researchers in Rhode Island knowing this, having a consolidated list available to them to summarize those 112 priorities that are coming out of so many different places, I think is a great resource and a way that you can start to or continue to think about, how does what you do link back to community health priorities? So you can see things about access here, mental health, food access, empowering youth, environmental risks and environmental justice, safe places to play, affordable housing, and public transportation are kind of the main themes that are coming up here. And what we did with this list, and some of you out there listening might have received this email or responded to this survey, we put these in a survey where we asked researchers that had been supported by Advance-CTR, so either funded as an awardee or used some of our support services for their project, our service corps. We asked them to indicate for each one of these priorities if their current CTR supported research either directly or indirectly relates to it, and or if their future research could or likely will directly or indirectly address any of these needs. And so far, actually, this is a little out of date. I think 10 more people or so have responded since I put this graph together. So far, we're seeing that one thing that is great is that someone is doing something in each one of those domains for health priorities. We have current and future research planned across all of those themes that I just presented to you, and access, which has been a huge theme across all of the priorities that we have inventoried, is one where the most current research is currently happening and the most future research is planned. So that is a wonderful finding. And I want to say this now before I forget. If you are someone who has responded to this survey, thank you so much. Your insights have been awesome. It has been really fun to read. And you'll see in the next slides coming up that we also asked researchers to explain to us, to describe how they see their research directly or indirectly addressing the needs that they indicated. So these will be some great ideas for you all to start thinking about too, how you would make those connections. But I do also want to point out about this graph, we have another graph that I didn't include in this slideshow for time, but there's one graph where I have combined these responses on current and future research. So did the researcher indicate that either their current or future research would address any of these needs versus people who responded to the survey but indicated that their research was not applicable, not applicable, not applicable. There are about 50% or maybe a little bit more at this point of respondents who did not make connections to any of these priorities with their research. So it's a great start and a great foundation, but it's also important to note that there is still a large percentage of research that either does not connect or researchers do not believe it to connect at this point. So important to note. So let's get to the qualitative responses because these are just awesome. And I have them in kind of three major themes that came out of how researchers are seeing their research connect to these priorities. One of those themes was technology. My work uses technology to bridge factors that cause disparate access to evidence-based, high-quality healthcare resources. I hope technology can help overcome some of the inequities in our community with internet-connected device ownership near saturation. A great point. And this orange quote on the right, by creating access to technology-delivered resources to increase physical activity, there can be increased access to preventative care resources, regardless of location. And this research was also conducted from a community-based perspective to increase their well-being, health awareness, and resources in the community. So one of the themes we are seeing is really getting the knowledge and getting the resources straight into the palm of the people who need it most. And that's a very powerful tool. So I love that. We also see a theme of data science, which is great. You can see here we have this arrow notation, which I love, NLP, natural language processing, / machine learning to identify suicidal ideation, suicide attempt cases, and then that to monitor high-risk patients and ultimately develop a clinical alert system. So huge touches on mental health and at-risk populations, and starts from machine learning, which is a great link. I also, want to point out here that when you're thinking about how your research connects or how it might connect, it's not about, having one arrow. It's not about being able to say my research is directly related to this community need. It's how am I one of these cogs in the pathway from what I do to community health priorities. This is translational research, right? So it has to move from benchside to bedside. And we expect that research falls within that spectrum somewhere and plays a part in that flow, not that it is necessarily the last arrow before it gets to the community. And I think that's a this one is a great demonstration of that. So we also, on the right, have a shout out to our biostatistics and informatics core. This researcher says that they most likely will use the biostatistics and informatics core to help develop a machine learning approach to categorizing grocery purchase data into food groups and develop a recommender algorithm to incentivize healthier choices. So using data science to make life more convenient and easier to access healthy choices. Another theme that was seen is talking about specific demographic groups or specifically addressing health disparities and social determinants of health. So making those kinds of connections. So you can see an examination of socio-demographic and underlying health status factors associated with pediatric sepsis. And then that leads to identifying potentially modifiable risk factors and alters how providers should understand risk of individual patient presentations. And it's a great link. We also have in the black box down here, something about opioid use disorder and reducing barriers to treatment in that domain, and a second thought in that box about the health disparities when it comes to access to COVID testing and vaccination in New York City. People talking about biophilic circadian targeted lighting. And again, you're seeing 4 or 5 arrows here leading to that theme of mental health. Environmental justice and environmental chemical exposures on anxiety and depression in adolescents. So again, that's youth, that's mental health, and that's environmental justice, all wrapped into one little blob right there. Understanding of healthcare needs, insurance choices among racial and ethnic minorities, again, speaking specifically to health disparities and underrepresented groups. And here, I honestly love that this one just says cord blood metabolites and makes a succinct link right into the community and reducing exposures and providing education and resources for pregnant women to reduce these kinds of exposures. So there are just so many connections that have been made. And while I would have loved to read all of those word for word to you, time does not allow for that. But I hope that in seeing some of them and hearing about some of them and seeing how researchers have conceptualized where they lay in that path from benchside to bedside and how their research gets back at these themes, it has sparked some thoughts for you. And so with those themes in mind, technology, data science, data visualization, getting the information into the hands of the people, and other techniques and strategies that we can use, I want to hand over this presentation to Dr. Plaut to talk about some of the strategies and resources that are already available for addressing local health priorities, and hopefully this will continue to spark thoughts for you. So with that, I will turn off my camera and invite Dr. Plaut to come on.
Thanks so much, Dr. Fede and Dr. Padbury, for having me today. So as Dr. Fede just said, my purpose is to expand on how you might address community priorities and what resources are available at Brown to support you if you wish to do so. Next slide, please. Great. So it's important to think about how we engage in the work that we are talking about to address community priorities. These, even if you haven't done community engaged scholarship or community engaged teaching, I'm sure these principles will look familiar to you from other sorts of collaborations that you have had in your life. Just to name some of those keywords, you can see in number 2, agreed upon goals, outcomes, and processes for accountability. Number 3, mutual trust, respect, genuineness, and commitment. Number 5, power and resources are shared among the partners. If you aren't familiar with community campus Partnerships for Health, which is the source of this statement on authentic partnerships. I encourage you to read the full statement and to utilize some of their other resources. It's a really wonderful network that is grounded in health in particular, although broadly understood in the same way that you all are talking about social determinants of health and environmental determinants of health. A different way, if you wouldn't mind, next slide, a different way of visualizing some of the similar ideas comes from Nexus Community Partners in Minneapolis, which worked with a diverse set of grassroots community organizations to define community engagement. And as you can see, there are many different issues which they see as interconnected and all potentially advancing equity. But what I would draw your attention to primarily is the set of words in the middle. So again, they'll resonate with some of those principles that we were just looking at. If you see trust, culture/spirituality, healing, history, identity, power, and relationships. And I think it's easy for those of us who are grounded primarily in academic institutions to be passionate and dive in with good intentions, with ideas for specific projects or research, with grant funding and opportunities that we want to invite other people to participate in and contribute to. And what community members and organizations, which are not always the same thing, I would say, oftentimes the representatives of community organizations come from communities that they are working in, and oftentimes they don't. And so to the extent that the Swear Center is able, we partner not only with and listen to the voices not only of community nonprofits and other agencies, but also to residents as well. And I think what the emphasis we hear and many others here in doing this work is that we want you to know us, to respect our knowledge, to understand your own positionality in relation to the issue, to build on strengths. So I think the language of priorities is a really positive way to talk about community issues that community members care about addressing, as opposed to talking always about needs, which focuses attention on deficiencies in communities and may miss ways in which community members will have insight into how to address particular issues, how to survive and thrive despite disparities and other circumstances. So I think, remembering it's just an invitation, whether you're already embarking on this kind of work or considering it for the future, that taking some time to think about the history and the context in which you would be operating, your own relationship, your own identities, power dynamics, even simple things. Some collaborators have said not using our titles is a powerful shift, so that if we're all being referred to by our first name, or all as Ms. or Mr., or different groups will make different decisions about how to do it, but that to the extent that we can address power dynamics and build trusting, honest relationships, we can accomplish more together. So next slide, please. And of course, I think these principles of co-creation and developing deep relationships in order to do collaborative work are daunting, because it does require significant time and energy. It can be contentious and uncomfortable. It can be risky. Oftentimes you all probably know even better than I, there may be pressure to be producing original knowledge, to be publishing and getting peer-reviewed grants and articles, as opposed to rewards for collaborative production of knowledge or creation, dissemination of information and insights in community-based outlets. So there are ways in which this work is countercultural for people who are based in universities, and at the same time, there's great value in designing and conducting research in ways that build on community knowledge and with community members. Next slide, please. And I wanted to just quickly share one example that relates in part. So you saw in the earlier themes that housing was an issue, and even one of the specific examples of a priority from the concept mapping exercise was lead-safe housing. So in Minneapolis, there was a long time, and there still continues to be, collaboration, although under a different name, around a number of different health issues, including lead-based childhood lead prevention, poisoning prevention. And Susan Gust is a community activist who actually, because of this long-term collaboration, was inspired to get her bachelor's degree in her 60s. And Kathy Jordan is a University of Minnesota faculty member. So they're two of the leaders of some really long-standing collaborative work and research on health. And one line I'll read to you that gives you some sense of the effort it can take to develop a really strong partnership. Some of the faculty, including Kathy Jordan, wrote in the acknowledgements of one of their other articles in Health Promotion Practice, "We will forever do our work differently thanks to the thoughtful and tenacious teachings and leadership of the residents." So it took them some time to develop trust and a shared vision for their work together, but there were several lessons from it that I think are worth noting as we consider how we can best address priorities in Rhode Island. So one of the critical things that the researchers learned was that residents could identify contextual factors, different potential confounding variables that might threaten the results, the validity of the results of their research if they were doing their work without that collaboration. And so researching the impact of lead poisoning prevention education programs, for instance, wouldn't be as effective if families were moving so often that you couldn't engage and track them over time. Housing insecurity wasn't an issue that was on the researchers' radar when they began, and it did not derail them from pursuing their research agenda, focus on this prevention, education, evaluation, but they did become engaged in some new ways because of what they learned through this relationship with the community activists. And that was that the collaborative began to advocate for changing city policy so that families whose homes were found to be contaminated by lead wouldn't end up homeless or in shelters. Another key strategy that they developed through the collaboration was hiring as peer educators people who were from the local community, would be perceived as peers in a way different than if they had hired educators or social workers. They found that it made a difference in attracting research participants. Research participants also then became ambassadors for the project and recruited other people. And it essentially became a form of community and economic development in addition to contributing in very significant ways to the research itself. So this group, and in particular Susan and Kathy, created a community impact statement as a resource that they thought would be useful to others aiming to pursue this kind of work or considering it. And I just recommend it to you as a set of questions that can be helpful, even begin embarking on something or to work through with potential partners. And it's inspired because Susan Gust had experience with environmental impact statements in the construction industry. And so it's really meant to be a collaborative planning document that invites you to think through issues that might cause conflict later if they were not addressed upfront. Next slide, please. And so I want to shift now to be sharing, to some extent, infrastructure at Brown University that exists to support you, because one of the key messages, if you remember nothing else today from my section at least, it's that we are here to support you and you do not have to do this work alone. I work primarily within the Swery Center, which is housed within the undergraduate college at Brown, but is happy and willing to be a resource, as you heard from that concept mapping project, to any of you who are interested in pursuing community engaged research. So this is just, I'm not going to read through all of this, but want to emphasize, we try to get out not only examples of good engaged work that's happening, but all sorts of practical resources, and to recognize and award good work. Next slide, please. We also, as was mentioned in the concept mapping process, we have a community advisory board and a community partner network. And so we have a set of relationships where if you're wondering about potential partner organizations, we're certainly happy to think with you about those that might make sense for particular projects, and also to bring, if appropriate, ideas to those groups for discussion and input as you're working, or if you're trying to disseminate results. Obviously, those are additional resources for you. I also wanted to mention this university-wide working group, which aims to highlight and make visible and support and facilitate this kind of work across the university. That link is one where you can get more information. And on the next slide, you'll see some of the units on campus that are represented and eager to be of assistance. So for instance, if you might want to engage at all with K-12 schools in Providence or in Rhode Island, the Annenberg Institute has an education coordinator position and is doing all sorts of work to try and understand the priorities of the school district, of the community members, families, and kids in school, and to support work across the university and beyond that builds on strengths, that coordinates with each other, that ultimately is impactful, and that more and more is co-created with people outside the university, so that we're, again, not showing up just with an idea, an event, a plan already in place, but that we're really ensuring that our work is done in coordination with them. And the university library, for instance, I would say there are many units on campus that are probably doing more than might be visible. And so again, if you have questions about any of them, I'm always happy to serve as a liaison or a link to connect you with others. The university library has identified community engagement as a priority moving forward. They're going to be hiring a community engagement librarian and do a lot more work with digital scholarship and house this Brown digital repository that can be a place for public dissemination. There are all sorts of people on campus and networks. The Leadership Alliance is based here, but works with a wide range of institutions, including many historically Black colleges and universities, on engaging historically underrepresented students in research. So there are all sorts of organizations and units on campus that are potential partners for then supporting the work with the broader community as well. Next slide, please. And I think, I can't even begin to tell you all the other things, much less to talk about all of the community-based partners and resources that are available to you. But I wanted to seed some ideas and again invite questions and suggestions and connections later. The technology theme that came up earlier, a couple of things I would highlight. The computer science department at Brown, the undergraduate concentration has something like 18% of the undergraduates, and the department is very committed to social responsibility and social impact. The chair of the department teaches a CS for Social Change course in which advanced students work on projects that are proposed by community-based organizations or sometimes faculty or units that are seeking to have a social impact. And so if you are one of those people who's thinking about technology as a means for translating your research into public benefit, they're a potential partner for you. You know, many times they're looking for new partners for their courses. The data science piece that was raised as well, there's a data science initiative, there's a new undergraduate certificate. Students have to be completing projects for that experience. There's the possibility of mobilizing and leveraging student passion and time and developing expertise for data analysis and visualization projects. You know, the Native American and Indigenous Studies Initiative has a tribal community member in residence to inform engagement. There are just many centers, if you're trying to get grounded more in the local context and understand, you know, even using in these times when we can't do in-person walking tours, the Center for the Study of Slavery and Justice has created this digital walking tour. So many different units and collaborative initiatives on campus that are aiming to support engagement that is culturally grounded oftentimes, that's responsive to community priorities and expertise, and that builds on some of the academic strengths of the institution too. So again, this is not comprehensive, and I haven't told you in you know, all of the details of what any of these resources can do, but my main message is that the SWARE Center is one of the hubs, and Advance-CTR is certainly one of the hubs for supporting this kind of work, and that we aim to walk with you in thinking about how you can, again, begin or continue or enhance your work in ways that are not trying to save or fix communities, but collaborate with and contribute to community priorities in alliance with community partners in ways that do recognize community strengths and ultimately build on the outcomes that we are all committed to. So those are some of my initial thoughts, but I welcome, as does Dr. Fede, any questions or comments about that, including Dr. Padbury. I know that RadXup has is an example where you've done some creative partnerships. It's not only the obvious partners. A point I think is worth emphasizing is that partners are not necessarily always going to be explicitly or primarily focused on health, but maybe, you know, Progreso Latino and other organizations can have distinctive value in a collaborative as well.
So I will say a word about RadXup, but before that, I would like to actually invite Jacquelyn and you to say a word about one of the concrete ways that we are hoping to make early, fruitful, and reciprocal partnerships with the community through a very structured exercise called Design Studios. And I wonder if Jacquelyn could say a word about Design Studio and how it accomplishes these goals of reciprocity and partnership from the outset.
Yes, the Community Engagement Studio or Community Design Studio is really meant to be a collaboration between the community members you aim to serve and you and your research team. And it is one of the things that we, Advance-CTR, have proposed going forward with this community engagement and outreach core to do. We would serve as a liaison. We would set up the studio. We would bring researchers in and prep them for this studio. And essentially what happens is a researcher would come to us, tell us where and why they need community expertise and community collaboration. And we would tap into our resources, our connections, the SWARE Center's resources and connections, all these other existing places on campus that may have connections in our own community advisory board, to get a group of people who fit the criteria that the researcher is looking for and who are interested in sharing information or experience on this topic. And the researcher would prepare about a 10-minute presentation with what they're looking to do, what they're hoping to do, and we would come up with 3 to 4 broad questions between us and the researcher that we are hoping to get information on from these community experts. And this can occur at any stage of research. It can be about what are the questions that I should be asking. It could be how do I go about recruiting from this specific community in a respectful way. It can be how do I get these findings I have into the hands of people who need to use it. It can be a wide range, any part of the research process, but one of the most important points about it is that you have this initial studio time where your research is presented by you and community members discuss it from their perspective of being the community expert. You get that feedback, you make changes, you do what you learned from the studio, and then you go and you report back to the community. You tell them, how did you make changes? What did you use? Or you have more follow-up questions at that point. And it's meant to avoid that one time, one and done, take what we need and never go back to the community kind of experience that so many organizations and community members have experienced when interacting with researchers. So it, again, could be its own presentation, and it has been its own presentation. Do we have that one recorded? We might. Check out our website. We might have that one recorded. I'm not sure. But if we don't, we can post at least some slides and information about it along with this.
So in addition to those very solid remarks, I would add emphasis on reciprocity, actually asking the community, is this a good idea? What did we not think of? What are the unintended consequences?
Oh,
and
yeah.
also using the opportunity in the studio setting to develop partnerships, because we envision the community engaged projects going forward in phase 2 of Advance-CTR as being a partnership between a university-based investigator and a community-based partner. Those are going to be prerequisites, for projects that we're going to support, and that health priorities that you identified are going to be the domains that we're going to want to emphasize. So.
That's a great point, and we'll say that again. That list of priorities in purple. Keep that by your side and think about it when you write grants, because if we have community members as part of the review process and who are going to be partnering on projects, certainly we will want those projects to be in line with what the community said was important to them.
So we want to get to the questions, but I will say just a quick word about RADx-UP, which is rapid acceleration of diagnostics in underserved populations. And it's an award that we received as a supplement to the Advance-CTR. It's being led by Neil Sarkar, Phil Chan. Neil directs the biomedical informatics and Rhode Island Quality Institute. Phil's an adult infectious disease doc. Yovanska Duarte Velez is in the Department of Psychiatry, who's a community-based researcher working on mental health, and Mario Bueno, the director of Progreso Latino. So the way RADx-UP is approaching mitigating the impact of the COVID, the disproportionate asymmetrical impact of the COVID-19 epidemic on the Latinx community, is to go to community partners. So we have a whole list of them: Progreso Latino, Clinica Esperanza, the Rhode Island Free Clinic, Thunder Mist, Blackstone Valley, and our workforce, our promotoras, which is a long-standing, well-established, well-accepted peer community health workers from the community, by and for the community, who are leading focus groups and directed efforts at explaining the importance of testing, the importance of tracking, and as we enter the vaccine era, the importance of vaccines in the community, at the community level, with the community. So we're extremely proud to be among the 17 RADx Up funded across the nation. So let's take a look at the chat. Can you see the chat, or do you want me to read these for you?
I can see chat, but I don't see any questions.
So I'm looking for individuals out there who want to post questions or ask anything from either of our speakers about the material presented. If not, then this has been recorded. There were a wealth of incredible resources shown on the slides. In particular, important contact information from in Julie's slides, and background reference material for planning your community engaged project, and of course, describing how we'll help you learn to work with the community through design studios, if that's what's going to pass. And this, I think, was just a tremendous presentation. I can't tell you how inspired I was, and I want to thank both speakers and encourage everyone, please fill out your evaluation survey. Let us know ways we can help you with your addressing community engagement health priorities.
I will say,
speakers have another closing thought. Jacquelyn.
Sorry, Dr. Cadbury, I cut you off there. I did want to say that I got confirmation that the Community Engagement Studio presentation is on the Advance-CTR YouTube page. So if that was something that sounded interesting to you and you want more information, go there, and that has the full details of what that process entails. And then I also just wanted to remind the researchers out there to really think again on those questions about how your research connects to community health outcomes and priorities. Does the community know how? And could you explain it to them? And hopefully in seeing some of your peers' ways of conceptualizing this and seeing some of the resources that could be available to you, those connections are becoming clearer, and hopefully you too are inspired to keep these themes central as you go forward.
And use us.
Yes.
We are here to help you to turn something that seems kind of ethereal or, as Julie said, scary perhaps. Use us to help you approach this. Julie, do you have any final thoughts?
No, I just think one thing that occurs to me is to reiterate, as you're thinking about those important questions that Dr. Fede raised, you don't have to do it alone. That as Dr. Padbury just said, we are here, others are here as allies in that work, and part of the joy of collaborative work can be building on the insights that different people bring to this. So we just encourage you to connect. The other complication of not doing this work as individuals is, as we all go into communities that we might not already belong to and have deep relationships in, we'll be responded to not only as individuals, but also as representatives of institutions. And so keeping in mind that reactions may be shaped by past things that are beyond our control, but that it is still possible to overcome any stereotypes, biases, fears, mistrusts, etc., through this kind of collaborative work together for shared self-interest. I think that's a really key point. So thank you all so much for being with us today, and we look forward to connecting with you moving forward.
Thank you to both speakers on behalf of Advance-CTR, and we look forward to working on projects with you.